Hello everyone, how are you all? Today in my last video I had mentioned to you about how frequently you're supposed to do the Pap smear test, and today I'm going to give you information about how to prepare yourself to go for a Pap smear test and who has to do it and who don't need to do the Pap smear test and who compulsorily has to do the test. So when you go for a Pap smear test, you should not be in your periods. There should not be any vaginal bleeding, because whenever you have a vaginal bleeding and when we try to take the test, because of the blood, we will not be able to get good amount of cells, and when we examine it under the microscope, the result may not be that accurate. So please do your Pap smear whenever you don't have vaginal bleeding or periods. So the other criteria is if you are using any vaginal tablets or any hormonal tablets or creams or anything for various reasons, for some treatment or something, you're not supposed to use these medications for 2 to 3 days before you do your Pap smear test. Then some of you may be using spermicidal jellies or condoms or creams as contraception. So when you plan for a Pap smear, please avoid using these contraceptive methods for 2 to 3 days before you do your test. And also, you're not supposed to have sexual contact for 2 to 3 days. There should be sexual abstinence for 2 to 3 days before you do your test. So if you fulfill all these criteria, you can fix a pre-plan and fix it the suitable time, and then you can go and do your Pap smear to get a good and accurate result. So the next question is, some of you might have taken the HPV vaccination. So they may ask, should I do a Pap smear because I already don't have the risk of having a cervical cancer? So should I do a routine Pap smear test? The answer is definitely yes, because before taking the HPV vaccine, you might have some HPV virus which have infected you, and the vaccination doesn't give you, as I told in my earlier videos, the vaccination cannot give you protection against the viruses which have been already you have been infected with. So just to prevent any consequences because of that virus, you have to do your routine Pap smear test as per the recommendation which I mentioned in my previous videos. So the next another situation is when you have a hysterectomy, that is when you have your surgery for your uterus, when you have removed your uterus, should you do the Pap smear? This is actually a very tricky situation, because in the hysterectomy you can have two types of hysterectomy. That is, one is total hysterectomy and other one is subtotal hysterectomy. So total hysterectomy is when the uterus and the cervix both have been removed. So in such situation, you don't have your cervix, so there is no risk of having cervical cancer. So such people, there is no need to do a Pap smear. But the another situation is where they have underwent subtotal hysterectomy. So during surgery, while doing the uterine surgery, due to various reasons, due to various challenges which they face during surgery, sometimes it's not possible to remove the cervix. So just remove only the uterus and cervix is left behind. So if the cervix is left behind, such people have the same risk like other people for having a cervical cancer. So in such situation, you have to do your regular routine Pap smear test as per the recommendation which I mentioned earlier. The important thing here you should realize is, some of the women don't even have they don't even know whether they have underwent total hysterectomy or subtotal hysterectomy. So please, my request is, when you have your surgery, please discuss with your doctor, whoever has done the surgery for you. Please try to understand, ask them whether you have underwent total hysterectomy or subtotal hysterectomy. So that will help you to decide whether you need to do Pap smear or not. The other situation where we would recommend to do Pap smear compulsorily is people who have postcoital bleeding, that is having spotting or few drops of blood or bleeding after having a sexual contact, or women who have intermenstrual bleeding, that is having spotting in between the periods, or who is having irregular vaginal bleeding, or some of them can have repeated episodes of lower abdominal pain or backache, like that. Such people should compulsory do a routine and regular pap smear. And some women, after even attaining the menopause, some women can have bleeding after attaining the menopause. Such women should compulsorily do the pap smear test. And on examination, sometimes we can see some abnormally looking cervix. So the cervix, when it is doubtful, they have to definitely undergo the pap smear test. So these are all the situations where you have to compulsorily do the pap smear test. And some of the high risk patients are people are like who are having HIV infection, and some of the women may have already underwent organ transplantation surgery. Such people will be taking a regular immunosuppressant medications. So when you take an immunosuppressant medications, the body's ability to clear the HPV infection is not good. So they have very high risk for cervical cancer because of the HPV infection. So such people without fail must compulsory do their routine and regular pap smear test. So I think this information is enough for today. In my next video, I'm going to inform you how to do a pap smear test and what if the pap smear is abnormal, how to go about all this. Till then, take care. Bye.
If you like these videos, please like, comment and share. And for more updates on women's health, please subscribe to my channel.